acknowledge and appreciate your partnership for the business during the post-COVID through MOH programs. Ladies and gentlemen, I can just want to remind you that during this time when businesses were distracted, businesses were closed, and we saw many people losing their jobs. His Cabinet Secretary, Mutahi Kagwe, actually gave the opportunity, members from every county of this country, an opportunity to actually re-engineer their businesses. We saw many getting back into different businesses. And he gave us an opportunity also to work with regulators like the Kenya Bureau of Standards, who came in to support women, and they were able to get an opportunity to supply over 7.8 million masks. Thank you, thank you, thank you. The masks were supplied directly by those suppliers to the Ministry of Health, and I can tell you that really their business, and today most of them now can be able to go to financial institutions to get a boost so that they can continue with other businesses. And so many.
At the height of the pandemic, I remember sitting with Richard Gatia and your members and just discussing how can we support the membership so that they don't suffer totally from the impact of the closure of the economy, the closure of the schools and homes and what have you. And that's how we arrived at the making of the 7.5, is it 7.5 or 7.8 million masks that were made by members of the chamber. And I want to thank you. I want to take this opportunity to really thank you for the work that you did and the help that you gave us. But that was not all. In the midst of that pandemic, and I want to be very clear about this, and I ask the media to also work with the chamber, and particularly to work with the chamber and understand the chamber and their work. Because it is so easy to write wrong stories, which then culminate in images that are not correct and not true. For example, during the same COVID period, we worked together in supplies of goods that were not available. I have challenged Parliament, when I went to Parliament to discuss all these KNCCI issues, at the time when they were called Covid Billionaires, and the only money we had was in millions. So I've never quite understood that equation. But anyway, I challenged anybody. I said, how much was the government buying a PPE at? I want you to go to Aga Khan Hospital, I want you to go to Nairobi Hospital, and if the government bought a PPE at 1 shilling, more than any other person, more than any other institution, then those people should pay. But as it were, across the world, everything was expensive. And that is something that we forgot. Because something costed 15,000 at that time and cost 2,000 at this time, does not mean that the members, the business community, was stealing.